and welcome. My name is Julie Dybert, and my presentation is on speech sound disorder. In this presentation, you will learn what speech sound disorder is, and I hope from that knowledge you will be able to be better equipped in your teaching. What is speech sound disorder? It affects a child's ability to talk properly. So when a child is making mistakes in his or her speech, and it's at the age that when the child should no longer be making those kind of mistakes. It can be broken down into two parts: articulation disorder and phonological disorder. Articulation disorder is when a child can either substitute, leave out, add, or change sounds in words, or a child can distort the word. An example of substitution would be W for L, as in look to look. Another example of that would be rabbit to wabbit. An example of a letter being left out would be nana from banana. Distortion is when a child is slurred when speaking. Phonological disorder is when a child makes mistakes with patterns of words. So an example would be using letters that are formed in the front of the mouth, T, instead of the back of the mouth, C, K. So they would say tup instead of cup. Now many children have these kinds of problems pronouncing words like these when they're young, but they develop and grow out of it. Most children are no longer have these problems once they reach the age of 8. Now, what causes speech sound disorder? Many cases are unknown, but they do know some things that cause it. A developmental disorder like autism can be a cause. Hearing loss when a child is either born with hearing loss or when they are young and have an infection in the ear can cause hearing loss, which also affects them with speech. And then a genetic syndrome. So an example of that would be Chard's syndrome, which my friend Amy from elementary school had. So I'll show a little snippet of her story.
At 2 days old, I was diagnosed with Chard's syndrome, which means I was supposed to be blind.
So there's a snippet of Amy's testimony, and in that little video you can hear her difficulty in pronouncing or articulating words. So how is it diagnosed? A speech language pathologist can evaluate a child, and they have formal tests that they can give the child and listen to the child as they pronounce and articulate the words. An oral mechanism examination can check to see if the child's muscles are capable and able to let the child pronounce words properly or not. And then the evaluation of the child's language development is done to see where the child stands in their communication. And is treatment possible? It can. A speech language pathologist can help teach a child to pronounce words properly. And the speech language pathologist helps in two different ways depending if the child has articulation disorder or has phonological disorder. So for the articulation disorder, the speech language pathologist helps the child to pronounce the sounds of the words correctly. And then with a child that has phonological disorder, the speech language pathologist helps the child to learn the rules of speech. So at the bottom here, I have a link to one of the websites that I found very useful in learning about the speech sound disorder, the American Speech Language Hearing Association. It has a lot of different links also if you want to delve more into different aspects and you have any more questions. It's a very useful tool. Now on to teaching strategies. Creating an accepting and welcoming atmosphere for communication is important. It's important for communication between you and the student, but also to encourage communication student to student. Encourage extra thinking before speaking. You want to give the child time to process and then give them time to try and articulate the words as well as they can. And then using multi-sensory learning can also help a child. So an example of that would be having when doing vocabulary, stomping to the syllables or clapping to the different syllables, or maybe putting the new vocabulary to a song would help. And then positive reinforcement. Always remember to be encouraging to the child. And avoid direct correction. So if a child pronounces a word incorrectly, you don't want to directly tell them, no, that's wrong, this is how you say it. You can instead pronounce the word correctly and just move on and not confront them. When you don't understand your student, work together to reach understanding. So you can ask the child questions like, if they're telling you a story, you can ask, where did you go again? Or what was your friend's name? I didn't quite get that. And then always encourage your student to talk and work on his or her speech. It can be very discouraging for a student that has trouble with speaking, and they can then just not want to talk. But always encourage them and then help boost their self-esteem. So there are some technology for speech sound disorder. Computer software is available to help the child in practicing words, and it just gives them another way to practice, and if they don't like talking among people, it's just a way to help, again, hopefully boost their self-esteem as they hopefully improve their speech. And then there are alternate communication, ACC, which can be electronic or not. One example of ACC is communication boards, and again, these can either be electronic or not electronic. The picture that I have on the right is of one that would be used at like a hospital, so the patient could let the doctors know if they feel sad or not, and the doctors can point to like the one that says it's time to take your medicine, and so they can communicate through that if they're having trouble communicating through speech. I hope this presentation was helpful for you. These are 4 questions I came up with to check and see what you did learn. I thank you very much for listening. Enjoy your day.